entry site construction in DMEK is very much as for standard phacoemulsification. We're starting with a two-step entry right on the limbus, so you see a tiny little bit of leak of blood there. That's a perfect position. And then raising the pressure in the eye as you enter parallel to the iris, about a 1.5 millimeter travel, then coming round for your paracentesis, getting that nice trapezoidal section using the keratome there, and again raising the pressure in the eye to make the entry site there. And then another extra one at the top, so we get access to the chamber on 3 sides. You can just see the blade coming in at the top there, and again raising the pressure with the other hand all the time. And then the air exchange paracentesis is much more vertical, and it's just a small one for a 30 gauge Rycroft cannula to help you control the chamber at the end of the procedure. So to recapitulate, your main entry site is right on the limbus, a 2-step incision. The reason for doing a 2-step is to give you better sealing function, and also if you ever need to suture it, you can do a nice tidy suture in the vertical section. So here it is, 2 steps there. Turn the keratome over, raise the pressure in the eye with the left hand, and enter parallel to the iris. And then your paracentesis, again looking for that nice trapezoidal section you can get with a partial entry with the keratome. One on the left hand side there, one around the back, and one at the top. And here you can see that nice entry parallel to the iris there. And finally the air exchange, somewhere convenient between the main entry site and the paracentesis, little vertical one there. And we often do a second one just to finish off at the end of the procedure. And then you can alternate between these two vertically orientated paracenteses for a nice controlled exchange of fluid and air at the end of the procedure. We'll talk about that more in a later video in this series.